Welcome to Pharma. Dear managers, when you are doing joint field work, obviously you have to do calls and we call them joint calls. Let's talk about which four type of call you can do when you are working with your representative. Let's talk about a common situation. First of all, the first type of call is called a joint call, where you and your representative are in sync. Both of you know exactly what you should do in that call. Start the call, who will start detailing, who will take the objection, who will close the call. If a doctor has reduced the prescription, who will ask him for more prescription. If you want to switch over another brand, who will take that particular opportunity to switch over the brand. All these things you will decide before entering doctor chamber. So in short, as it is in orchestra, everybody knows when to play which instrument. So the call is orchestrated, the call is arranged, the call is discussed before entering the doctor's call. This is called joint call. Now let's talk about second type of call, which is called as demonstrative call. If your representative is new, if there is a new visual aid, if there is a new communication, if there is a new input, or if there is a new campaign which you need to demonstrate and you are there in joint field work, in that case, tell your representative that you are going to do the call. Please observe, and in next call, he has to do the call the way you have done it. Please remember, to do this, you need to practice at home a little bit. Since you are matured, you are senior, and you are seasoned, I can say, so you can do it. Now in that call, you take everything, right from detailing, inputs, distribution, or campaign, or clinical trial, everything you do. And then when you go out of doctor's chamber, ask your representative to do it in next call. If he says he needs one more demonstration, without hesitation, do it in next call. But during that day, please ask your representative to do at least one call which he has observed. So this is second type of call, which is called as demonstrative call. Now third type of call, which is called as developmental call. Very interesting call it is. Sometimes you may have a new representative, or you may have a representative who is there in the system for a long time, but unfortunately has not developed his skill. Now this is the most important area for improvement. In this case, tell your representative that you are not going to talk during the call, absolute silence, but tell it before entering the chamber, that whatever doctor will ask, whatever will happen, a representative is the sole person. He has to consider it as if he is doing the call alone. He doesn't have manager with him. And you be a silent observer, completely, absolutely no talking, only the greeting with doctor. That's it. And then let the MR make mistake, because unless he makes mistake, he cannot learn. And then once you come out of chamber, you can talk to your representative and ask him what went right, what went wrong, what could have been done better. And that is how you can explain him, guide him, coach him, and prepare him for calls to make. So this is a third type of call. Now let's talk about fourth type of call, which is called as takeover call. As the name suggests, take over. This is not planned call between you and representative, dear friends. This is not at all planned. This call particularly happens. Sometimes doctor is very big doctor, meets with an appointment once in 3 months. So here, in such particular doctor, you can't afford to make mistake. And if your representative is detailing and he is making gross mistake, or doctor is asking some question and he is not able to answer it, and just looking at doctor, you know that now this doctor is going to go crazy. The doctor is getting angry anytime with that question. That time, with the permission of doctor as well as the permission of your BM, you can enter the call. How you can do it? You can just tap your representative and say, excuse me, and say, doctor, he doesn't know what you are asking, let me explain. And then you take over the call. So here it's a win-win situation for all three of you. Nobody will feel insulted. But sometimes takeover call is must. So takeover call only when the situation is going out of your hand. So with this four type of calls, definitely you can develop, you can coach, and you can guide your representative for the next level. Because when your representative goes to next level, you go to next level. You can come out of this sandwich position of area manager and you can go for a regional manager. Till that time, keep working hard, keep doing this 4 type of joint call, and let me know in comment box what's your experience about joint field work. Till that time, देखते रहिए फार्मा जीत, जीत की तैयारी आपके लिए. थैंक यू.